and welcome back to another video from HSTV, and in today's video we are doing a bit of a sit-down discussion prompted by one of you guys commenting about how we as medical students can enhance our communication skills. So if you're new to the channel and you don't know who I am, my name is Heen Shamaz. I'm a fourth year medical student here at the University of Edinburgh, and I'll admit I'm no expert in this field because I'm not a fully qualified doctor yet. However, I did want to make this video because I think that communication doesn't have a strict rule book. I think that our communication will vary because we are all from different backgrounds, but also it depends on who we are communicating with. In the context of medicine, you will meet patients from all different walks of life, different backgrounds, and you'll actually have to tailor yourself to be able to come down to that patient's level and make sure that they understand what you're on about. Now, I have heard from a lot of patients about really good doctors and really bad doctors as well, and normally that experience has come from forms of communication. You know, so and so was rude to me, or so and so was a brilliant doctor. They really understood what I was saying and they really listened to me. So these are the kind of things that I'm really interested in, and I thought I'd make a video on it so that we can all benefit as a community. And remember that this is a discussion, so I know that this video I am talking to you guys, but remember that the comment section is always open and I do reply to every single one of you. So I want to know your thoughts on this topic as well. The best way to enhance communication skills, I think, is by communicating with lots of different people. And although you might feel a bit awkward or a bit shy approaching patients, because it can be really a daunting experience when you're first time on placement and you don't really know how to approach people, what I would say is just go for it. Don't be afraid. Put yourself on the spot in these situations, and worst case scenario, if you think that you just don't know what you're talking about or something's not going well, remember you are a medical student, so you can very easily get out of that situation by saying that, okay, I'm really sorry to hear this, or whatever it is, I'm gonna call over my colleague and let's sort this out, or whatever the matter may be. It's very easy for you to call upon a senior member to come and help you out in that situation. I think if you are feeling really awkward or you don't know how to approach a certain patient, even taking somebody with you into a consultation can be really useful and reassuring as well. So the best thing, as I said, is to get involved and put yourself out there. The more children, elderly, people from different backgrounds that you communicate with, the better you will develop those skills. I think you will very quickly clock on to certain phrases. For example, during history taking, the topic of smoking, alcohol, recreational drug usage always comes up. And there's a very specific way that you have to ask that question, because some patients actually might get offended. So I have like a few phrases in my back pocket that I like to use. These are some questions that we like to ask all the patients, so I'd really appreciate if you could answer as honestly as possible. Something like that, it reassures the patient that this is not a targeted attack, this is just a routine question to understand risk factors for a disease. So you'll kind of gather a lot more of these phrases the more you take histories and the more you communicate with patients. I think that forming good rapport is very important with patients, because the doctor-patient relationship, it requires a lot of trust, and patients can come in very vulnerable and they might share things with you that they've not shared with anybody else in their lives. So you're in a very honorable position here that comes with a lot of responsibility, and part of that responsibility is to actually make the patient feel comfortable enough to open up to you, and that includes asking open questions. If somebody comes in with back pain, don't just start asking your systemic and neurology questions. You open it up and you say, okay, tell me what's the problem, okay, how do you feel about this, what do you think is going on? All these kind of questions, they help the patient to become more involved in their health, and they will feel that they are being listened to rather than just directed or put down these tunnels of what you are thinking. So I think that the consultation, it really needs to be a good mixture of the patient speaking and you speaking as well. What I've observed, especially when I was in GP placement, is that in the first half of the consultation, the patient speaks quite a lot because they're telling you about their problem, and you're asking very open-ended questions. And then as you get to the end of the consultation, when you are kind of explaining your management plans, that's when the doctor speaks more. And I'm going to talk about how you do that management side in just a second, but the first part of that consultation is really, really important because it will direct your management plan as well. Now, that second half of the consultation could be a management plan, it could be an explanation of results or a condition, and here there's just a whole new set of skills that you need. And again, the more you do this, the better it is. But a technique that I really like to use is this chunk and check. And what this means is that rather than, let's take the example of if I have to explain what angina is to a patient who's been newly diagnosed. Rather than going in straight with, okay, so Mr. Brown, you've got angina, the heart is a muscle, blah, 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 and I start going into it, it's always nice to actually ask the patient what they know first and to say, okay, so Mr. Brown, have you been given a diagnosis? How much do you know about what I'm going to be speaking to you about today? And that way you'll prevent any of these shock moments or any moment where the patient has lost you or doesn't know what you're on about. Because they might not have ever heard of angina before. You might be the first person mentioning this to them, never mind actually explaining what it is. So it's really important to kind of judge the patient's knowledge level. I think on that topic of knowledge, you might have a patient who's a doctor, and actually they know a lot about angina already, so your way of speaking to them will be very different. But then you also might have a patient who maybe left school at the age of 16 and actually has a very poor education background. They don't know much about health conditions and all these technicalities of the human body. And in that case, again, you would have to explain things at a level that patients can understand. Sometimes a big trap that medical students and clinicians fall into is using medical jargon. We might use words like coronary arteries, but actually for a layman, they might not know what coronary is or what arteries are. There's a big difference between arteries, veins, and capillaries, but your ordinary layman doesn't know that. So then it's up to you to try and explain what that is at a level that they understand. Otherwise, that consultation is not going to be effective. You'll think that you've gotten all the information across, but it's just gone over the patient's head, and they'll only recall perhaps 30% of what you've said. So it's really important to keep chunking and checking. Did that make sense? Okay. Do you have any questions? Is there anything else that I could explain better? Things like that, just to keep the patient engaged as well. Now, remember that communication is not only about talking and listening, but it's about your general body language as well. So you never want to be in a position where the patient is looking up at you like this, or you are not making eye contact because you're too busy thinking about how you're actually going to explain angina, or you don't want to come across aggressive or anything like that. You kind of have to match the energy of the patient whilst remaining respectful and professional all at the same time. So in the hospital, what I like to do is I'll grab over a chair, sit beside the patient, and then actually move their bed up or down, just so that we are at a good level and we're comfortable speaking to each other. That's really, really important. We don't realize our non-verbal gestures, but they happen all the time. I remember I was actually at a communication skills workshop, and I remember I was asking about the presenting complaint, and then once I'd asked all about that, I actually sort of sat back in my chair and I was like, okay, so tell me about your health in general. What other medical conditions do you have? And the examiner or the assessor or the tutorial lead, they sort of picked up on that, and they said, actually, that little gesture of even just sort of sitting back in your chair it almost gave the patient a signal that, right, we're moving on to the next part of the history. So it's little things like that that we don't realize even ourselves, but just to be very wary of. Some people have a habit of fidgeting, and again, we really have to try and be careful with that when we're in front of patients, because you don't want a doctor that's like shaking their leg or fidgeting about with their hands. So again, just to be wary of those things, and it all comes with practice, but the more aware we are, the more likely it is that we'll recognize what we're doing during the consultations. Now, remember that communication is not just with patients. You will have communication with your colleagues at medical school and beyond, and obviously that is a different type of communication altogether, because there's more likely to be conflict, there is more likely to be a difference in opinion, difference in background or way of thinking or approaching situations. And again, I just think that if you're ever in a teamwork project, any project at all, you know, even if you're in high school watching this, just try to play a proactive role so that you are really exercising those skills. If you just sit there and do nothing, or you let people boss you about, your communication skills are going to be affected, and ultimately that will affect your practice as a doctor. So try to be as proactive as possible and try and exercise those skills of listening, of speaking when it's the right time. How do you deal with conflicts and situations where there is a difference of opinion, and how do we respectfully approach that? And again, the more situations you are put in, the better you'll know how to deal with them. Alright everybody, well that is going to be the end of this video. I know that was quite a lot of information that I've just thrown at you, and maybe some stuff that's quite self-explanatory, but I just think that communication is overlooked, and sometimes we are so focused on all of this textbook knowledge that we actually forget that the patient doesn't really know what we got in our exams, but what they'll remember us by is, did we smile at them? Did we cut them off mid-sentence? Did we use some complicated words that went over their head? That is the kind of thing that patients will remember. So we just have to be very wary of that. And remember, you can always practice with your friends as well, even though that's not always going to give you the most realistic situations, but it's better than nothing. And the biggest thing I want you to take away from this is the more you talk, the more you communicate, the more you put yourself in uncomfortable positions where you are forced to exercise those communication skills, the better you will develop those skills. So yeah, I hope that you found this video useful. As I said, I want to hear your views in the comments below, and I'll see you in my next video. Goodbye.